Inside this unassuming storefront on a busy Brooklyn street, drug users sign up to use a bathroom that's designated as a supervised injection facility, or SIF. It's operated by an organization called Vocal New York. Users are checked via intercom every 3 minutes.
How you doing in there?
And if there's no response, a staffer will come in, ready with anti-overdose medication.
Our job is not only to keep people alive, we want to keep them healthy. We want to get them connected to services that they're able to recover not only physically but mentally and spiritually, so when they do decide to move forward, that they'll be healthy enough to do so.
Opioids, from pain pills and heroin to the heavy-duty painkiller fentanyl, have spawned the deadliest epidemic of drug overdoses in U.S. history. Outreach worker Jeffrey Foster says SIFs take vulnerable people off the streets and away from stairwells, parks, rooftops, and porches.
It's a safe place. I know somebody got my back outside, you know. If things get, all I gotta do is yell or hit a button. Yeah. You know? I feel everybody should have a chance because they use drugs don't mean they're bad persons.
New York Mayor Bill de Blasio is seeking state and community approval for a 1-year test of 4 overdose prevention centers at privately run syringe exchange programs. Researchers say the city's proposal could prevent 130 deaths and save $7 million in healthcare expenses each year. But not everyone thinks the facilities are a good idea, warning they could stoke neighborhood resentment and send misleading signals that drug use is safe.
You certainly have to look at those who are suffering from chronic addiction and how are we going to help those people. You have to look at preventing people from falling into that black hole too. And I think that SIFs undermine that effort.
But advocates say people need to realize the battle against opioids is being lost.
7 years of growing overdose deaths in this city. 7 years. At what point do we accept it's not working? We need to drop a lot more money to inside the Department of Health and Mental Hygiene, public health approaches, and create these safe consumption spaces.
About 100 SIFs have opened in Canada, Australia, and Europe over the past 30 years. And other U.S. cities, including Philadelphia, San Francisco, and Seattle, are considering opening similar facilities. Julie Taboh, VOA News.